Hello, my name is Summer Stevenson, RN, CRRN, and I am a nursing student at Lamar University. I would like to welcome you to my capstone and 5-year plan presentation. In this presentation, I will address how I have met the 7 student learning outcomes required to successfully complete the Baccalaureate of Science degree in nursing program at Lamar University. This course is Nursing 4580, Synthesis of Professional Nursing. Again, my name is Summer Stevenson, RN, CRRN. My academic background began at Concord Career Institution in 2003, where I graduated with honors to obtain my licensed vocational nurse certificate. In 2011, I graduated with honors from Lamar State College, earning an Associate's of Science in Nursing degree. And now I am in line to graduate in May 2019 with the Bachelor's of Science in Nursing degree. I currently work at a 66-bed acute inpatient rehabilitation hospital in Fort Worth, Texas. I have worked there for the last 8 years. I began my career there as a staff nurse, then moving up to a charge nurse, and then in 2013 I was promoted to a nursing leadership position as a PPS outcomes manager. And then in December 2018, I was promoted to nurse manager. Committees and organizations that I belong to include Association of Registered Nurses, or ARN, the Nurse Advisory Committee, the Traumatic Brain Injury, or TBI Committee, and the Fall Committee. I have been a certified Rehabilitation Registered Nurse, or CRRN, since 2013. I also have certifications in ACLS and BLS. The first learning outcome that I will discuss falls under the Humanity and Society construct. Learning Outcome 1 practices safe and effective holistic patient-centered care to a variety of patients, clients, in multiple settings from a global perspective by incorporating theories and evidence-based findings. This learning outcome was met in Nursing 4540, Care of the Communities. In this class, our required assignments included Practicum 1, 2, and 3. Practicum 1, we were required to complete a project planning form and windshield survey to identify an at-risk special needs aggregate. I chose families living in poverty within my community. Practicum 2, we had to research how a disaster would impact the daily lives and health of that aggregate and the resources needed. And then lastly, Practicum 3, we had to create a disaster preparedness teaching plan and video with 5 measurable outcomes using Bloom's taxonomy. I felt this goal was met at 94%. Learning Outcomes 2 and 3 fall under the Lifespan Health Continuum construct. Learning Outcome 2 supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This learning outcome was met in Nursing 4540, Care of the Communities, and Nursing 4580, Synthesis of Professional Nursing. In Nursing 4540, we were required to partner with another student and complete a global health discussion board assignment, and then respond to 3 other groups. Our topic for our discussion board was hunger, poverty, and malnutrition. We discussed the nature of the problem through research, both in the United States and around the world, prevalence and incidence, contributing factor, and finally identifying a health agency addressing the problem. The 3 groups that I responded to were topics on lung cancer, pneumonia, and measles. In Nursing 4580, we had 2 case study discussion boards where we discussed ethics, dignity, empowerment, and advocating for health and safety for all patients. I felt this goal was met at 94%. Learning Outcomes 3 evaluates patient-centered care for patients, clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This outcome was met in Nursing 4620, Care of Adults with Compromised Multiple Health States. Practicum reflection assignments 1, 2, 3, and 4 in the CBSL assignment helped me meet this learning outcome. First, I had to identify an individual with a chronic compromised health state. I used stroke as my topic as I have a close friend that suffered a traumatic stroke at the age of 52. He had many health issues that contributed to his stroke. Through interviews with my friend, analyzing research literature, and evidence-based practice, I developed a teaching plan with measurable goals in nursing intervention. The CBSL assignment, I identified a community resource for stroke survivors. I interviewed the program lead volunteer and interviewed a stroke survivor attending the stroke survivor class. I felt this goal was met at 99%. Evidence-based practice and clinical reasoning constraint. Learning outcome 4. Synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. This learning outcome was met in Nursing 4390, Nursing Inquiry, Evidence-Based Practice. In this class, we had several discussion boards, module exercise assignments, and a group assignment where we could critique a quantitative research article about patients with heart failure and the relationship of cluster symptoms associated with heart failure. There were 4 students in my group, and we worked together via email and text messaging. These assignments gave me knowledge to critically think through research and evidence-based practice and to be able to apply it to my own nursing practice. I felt this goal was met at 94%. Patient-client-centered care construct. Learning outcome 5. Employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with clients, patients, and members of the interprofessional and intraprofessional healthcare team. This learning outcome was met in Nursing 4620, Care of the Adults with Compromised Multiple Health States, and Nursing 4390, Nursing Inquiry, Evidence-Based Practice. In Nursing 4620, the required practicum reflection assignment, I used the nursing theory, modeling, role modeling, to address a patient's concern related to compromised health state, which was stroke. This theory theorizes that nurses and patients are in a relationship, and the nurse learns about the world of their patients. In Nursing 4390, through discussion boards, quizzes, and research written assignments, I was taught to apply evidence-based findings into my daily nursing practice. I felt this goal was met at 99%. Learning objectives 6 and 7 fall under the professional role construct. Learning outcome 6 differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for a patient, clients, as a member of the interprofessional and intraprofessional healthcare team. This learning outcome was achieved in Nursing 4580, Synthesis of Professional Nursing. Assignments included 2 case studies in discussion board form. In both of the case studies, there was negligence in both the interprofessional and intraprofessional healthcare teams that resulted in near harm and in 1 case death. In these assignments, I discussed the legal and ethical liability of caring for patients and the importance of collaboration between all healthcare team members to include the patient and families. I felt this goal was met at 95%. Learning outcome 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. This learning outcome was achieved in Nursing 4550, Leadership and Management in the Healthcare System. The assignment that best helped me meet this goal was the Effective Leadership and Qualities assignment and the Clinical Application assignment. The Effective Leadership and Qualities assignment required me to explore effective leadership and qualities, characteristics of effective leadership, and self-analysis of my own leadership style and ability. The clinical application assignment had me identify a problem at my place of employment, do project planning and implementation to the team through effective communication and leadership skills. I felt this goal was met at 100%. My 5-year plan. In 2019, I will successfully graduate from Lamar University with a Bachelor's of Science in Nursing degree. In 2020, I plan to study for and test to obtain my Certified Brain Injury Specialist or CBIS certification. In 2020, I plan to enroll in a Master's of Science degree program for nursing administration. In 2022, I plan to apply for a Chief officer position within my company. And then in 2023, I hope to have successfully completed a master's degree program. I want to thank you all for listening to my presentation, and I would like to thank all the instructors for assisting me to achieve this honor of being able to graduate with my bachelor's. Thank you very much.